Welcome back to your course on the inflammatory process. And here in lesson 5, what I'd like to do is to start off with the activity that you completed in lesson 4, which was to sketch out a summary of the inflammatory process. So I'm going to start by showing you kind of what I came up for this summary. Now, keep in mind, I've had a little bit more of a chance to study the information, and so I do not expect mine to reflect what you have created, but I do want to show you what I came up with. And then after that, we're going to head into talking about some treatments for inflammation and, in fact, whether we should be treating it at all. So let's start by looking at our cast of characters again and events that should be included in our summary. So we had our blood vessels and the specialized cells. We wanted to include the events of margination and diapedesis. We're going to address all of the chemical mediators that are involved in it, and then end up with our lymphatic system. So taking a look at this summary overall, we're just looking at a picture of the inflammation. Now remember, everything starts off when we have injury to the tissue itself. Now, keep in mind, everything can be activated with this tissue injury and producing the damaged cells through the injury process. With that, or even separate from it, we can have pathogens and bacteria get into the area. And so even if there wasn't a lot of tissue damage, if a pathogen or bacteria was introduced into the skin surface, this will also instigate the inflammation response. So I want you to keep that in mind. So this tissue injury here, when damage is occurring, we will activate what are called our natural killer cells. Now, natural killer cells are sensing things that it encounters and deciding whether it is something that belongs to the body or does not belong to the body. So if it comes across a cell that is not recognized as a self cell because we've knocked the protein off that identifies it as part of the body, it will activate those natural killer cells. It also can happen when it senses bacteria or a pathogen within the body as well. And what ends up happening is these natural killer cells will release perforin and granzyme B, and that will go to attack these cells. It will poke holes into it and end up disintegrating the cell, trying to kill it. Now, our natural killer cells are not the only cells that are activated when we have the tissue injury. When tissue injury occurs and the pain that is involved with it, it actually releases bradykinin. And bradykinin is one of the things that acts to activate our mast cells. Now remember, what mast cells are primarily responsible for are two different things. One of them is activating the endothelial cells, but it also activates our macrophages. Macrophages are activated by the mast cells degranulating and releasing the TNF alpha. Then also they're activated by natural killer cells releasing interferons, which also acts to activate our TNF alpha. If there was a pathogen or bacteria in the system as well, that presence of that pathogen will activate the macrophage. Now, what's always interesting to me is that macrophages, when activated, will release the TNF alpha. TNF alpha, remember, is one of those chemical mediators that activates macrophages. So what ends up happening is that the macrophages will reactivate more macrophages in the area and continue activation of those same macrophages. All right, so part of what the mast cell does was to activate the macrophage, but also through the process, it will activate endothelial cells. Now, endothelial cells are activated not only from mast cells, but also through bradykinin. And remember, tissue injury itself will also release prostaglandins, which will act on the endothelial cells to aid in the vasodilation, as well as directly affecting pain receptors, instigating the pain stimulus. Endothelial cells, when activated, do a couple of different things. One of them is to actually feed back into the system by releasing interferons, which will in turn activate more macrophages in the area. It also releases nitric oxide and interferon into the bloodstream, which will end up dilating our blood vessels to increase blood flow to the area. Now, when macrophages are activated, besides releasing TNF alpha, they also release interleukin 1. TNF alpha and interleukin combined is actually the call for the monocytes and neutrophils to come to the area. Now, remember, now we enter one of our events of margination, in which the monocytes and neutrophils and other white blood cells start to slow down in the area and bind onto the endothelial wall in order to walk like a gear down the wall until it can come across an opening. Now, these openings were created by the histamine and bradykinin that was present in the system from mast cells, and also the heparin, which is keeping those openings open. And when these monocytes and neutrophils sense that there is a cleft in it, it will squeeze out through the endothelial wall, through one of these gaps, and that is the process of diapedesis. So with diapedesis, the neutrophils will now start to consume the tissue that has been injured around that we need to clear up, and the monocytes will differentiate into macrophages to join in the fight as well. Meanwhile, other things that are coming through in the blood vessels include fluid leaking out because of the vascular permeability, which leads to that warmth that we see as a hallmark. And then also what's coming out are fibroblasts, and fibroblasts are going to initiate the healing response. So we're going to start to build new fibers in order to repair the damage that has been done with the injury. Now, remember our last lesson in which we looked at our lymphatic vessels, and here they are represented, including the one-way valves, in which now we can actually start to pull everything back in and start to clean the entire area up from the injury itself. All right, so I want to take a moment to talk about the value of inflammation, because it does do great things within the body to work us towards healing. Ultimately, it begins the immune response in order to fight off these foreign invaders or the damaged cells themselves, to take care of them. It engages the lymphatic vessels, which will allow this infected material to be presented to the lymphocytes, and it starts to produce antibodies. So when we are dealing with bacteria or pathogens within the system, we now can start to produce antibodies to help deal with those. Because of all the changes in the vascular system and the permeability and the increase in blood flow, it starts to deliver more nutrients to the damaged tissue, as well as bringing that extra fluid volume will increase the lymph return. And so it can help to clear things out of the area. And if there was a pathogen or infection presented, it helps to dilute it in that process. Now, because the lymph system is so effective at its job with inflammation, it also helps to prevent any spread of infected material throughout the body. Part of what inflammation does, and the whole purpose of it, is really because it can now start to build new cells in order to help in the healing process. Beyond the amazing value that inflammation has within the system in trying to work towards healing, it does have some consequences as well. So when we have this fluid buildup, because it is building up, it can increase the swelling in the area. And this puts a lot of pressure in the area. And sometimes the swelling itself and the pressure that it's creating can lead to some negative consequences. And this is when we see the negative side of inflammation start to occur. With an increase in pressure in the area, it actually becomes difficult for new white blood cells to leave the blood vessel area, as well as our fibroblasts that are going to rebuild, and nutrients to help set up a great environment for rebuilding all of the damaged tissue, from leaving the blood vessel and going into that interstitium. Sometimes this effect can be so great that it also starts to cut off blood flow, both to and from the area. And when this happens, and in extreme cases, we can suffer from what's called compartment syndrome, in which the swelling has now blocked off blood flow and is now not allowing for all of these byproducts to be released back and diluted through the bloodstream by going through the lymphatic system, but it has stopped this process. And we can end up having a buildup of chemicals that are lodged within the system, and it makes it so that it's creating a negative environment because we can't clear it out appropriately with new blood flow and with the byproducts leaving through the lymphatic system. When this happens, it has a lot of proliferation and building of this negative environment. As the swelling starts to diminish, all of those chemicals can end up being released in one fell swoop into the system and can cause very negative reactions to the cardiovascular system itself. Another consequence of inflammation is when neutrophils and macrophages are activated to start consuming all of the byproducts and all of the damaged cells and pathogens within the area. It also can start to digest living tissue and healthy tissue as well. So we can have a lot of destruction in the area of healthy tissue if inflammation has gone rampant. Just some logistical consequences of inflammation is because of the increase in the swelling and blood flow to the area and the permeability changes, we do start to see this loss of functionality, and we have a lot of instigation of pain as well. So if we are not able to move the body part as well, and we're experiencing a lot of pain, you can see how that could be a consequence that would not be appreciated by the person who's injured. So now the question comes, do we treat inflammation? It's a great debate that is out there. A lot of people subscribe to the idea that when inflammation starts, we can start by instigating some steps to treatment in order to stop that flow of inflammation. However, something to realize is that inflammation is part of the healing process, right? So we looked at that before, in which it's bringing all of the nutrients into the system. It is helping to fight off and destroy any pathogens, bacteria, any dead cells that are in the area, damaged cells in the area. And we need these processes in order to survive and heal the area. So the question really should become, at what point do we start treating inflammation? I would say inflammation on its own is a good thing and is part of the healing process. But when it starts to cause issues and have consequences because of the inflammation, that is when we should actually start treating for the inflammation. So let's talk a little bit about some of the treatments and therapies that are out there for inflammation. So, ibuprofen is one in which we've already looked at in a previous lesson. And if we recall, the mechanism of action that ibuprofen worked on was to block COX-2, cyclooxygenase 2 receptors. This is part of our system with arachidonic acid, in which we can actually go through. It's a long step process, but ultimately releases prostaglandins to the area. So we can cut out pain by decreasing the production of prostaglandins. Also, what happens when we block our cyclooxygenase or COX-2 receptors is that it can result in vasoconstriction because of the prostaglandins being blocked. Now, with vasoconstriction occurring, we have less permeability for fluid to be exiting out of the blood vessel and less blood flow that is occurring within the injured area. Ice is another therapy that's often used for inflammation or for injury, in which it actually works on the pain receptors themselves to be able to numb the pain receptors response so that it takes a larger stimulation of the pain receptors in order to recognize it by the brain. Ice and having the cold temperature itself also acts towards contributing to vasoconstriction. So by decreasing blood flow to the area and decreasing the permeability and in decreasing the pain, ice can help to diminish the signs of inflammation. Another therapy that is commonly used with inflammation is the use of compression. And this is wrapping some kind of an ACE or elastic bandage around the area. And how this usually helps is to control edema. It controls the swelling by decreasing the blood flow to the injured area. Now, these are some of the therapies that are commonly used with injuries and the increase in inflammation, and are even taught in first aid classes. But the question comes, should we be following this? So you may have even heard of an acronym, RICE or high RICE, that is a way for us to deal with inflammation and injuries. The H in high RICE stands for hydrate. So, this is encouraging individuals to consume more water in an injured state, which is always a good recommendation because we are losing a lot of fluid into the lymph system. It's not available in the circulatory system as much. And so we would like to continue hydrating. So this is one that I would keep around from this acronym and the ways to treat injury and inflammation. Now, the I stands for ibuprofen, which is a nonsteroidal anti inflammatory drug. So the question is, should we be using ibuprofen as part of this healing process? Well, we do know that it does decrease inflammation and it does decrease pain. We've already looked at that. The problem is when we are stopping the inflammation from happening, we actually can increase the healing time. So the deciding factor of whether we should be using ibuprofen or not is how much are we affected by the inflammation that is occurring? If it is a mild or moderate amount, I would say ibuprofen's not needed. If you can tolerate the pain that is associated with this injury, ibuprofen is not needed. So I would take a look at those two factors of how much swelling is occurring and how much pain is being experienced. If those two things are a mild or moderate amount, I might hold off from taking ibuprofen with an injury simply because I don't want to increase my time to heal. Rest. Rest is the R in the RICE formula. So, this is the idea that we should get off of the injured area and not use it for activities. But what we are actually finding within the literature is that non weight bearing activity might actually be good for us. So, yes, we need to rest in the sense that we probably should not be re aggravating any of the injury, but it doesn't mean that we should stop all activity entirely. Instead, we can use other parts of our body to could be continuing in exercise and to increase our physical activity because it can increase blood flow in general and it helps us in the healing process. Now, the second I in high rice, or the I in rice, is ice. Now, we did look previously that it does assist with vasoconstriction to help decrease the inflammation and also can decrease the pain response. Now, the question is, though, are we needing to do these things? I feel like this falls into the category of ibuprofen, in which sometimes it's actually increasing the time to heal and perhaps should not be doing it. As of the next activity after this lesson ends, I actually have you reading an article that addresses whether ice should be used or not in these circumstances. Now, if it's used, some people recommend that instead of just trying to ice as much as you possibly can, instead ice it for 5 minutes and then take 20 minutes off of a rest from icing. However, I would like to question, should we be using ice at all? Now, the C in high rise stands for compression. We looked at on the previous slide that this does help to decrease blood flow to the area by slowing blood flow coming to the area, which will not allow for as much fluid to be lost through the permeability layer of the endothelium. It's really unclear on whether we should be using compression immediately after an injury or not. And compression can work on two different things. A tight compression in the area can decrease blood flow coming through the arterioles. However, what it also does is stops lymphatic flow back into the lymphatic vessels. By doing this, it hinders the process in which the lymphatics can clear out any damaged cells. However, small amounts of pressure in the injured area can actually aid in lymphatic flow. So perhaps doing a loose compression might be better than a tight compression, in which we can aid with the lymphatic system in clearing the area, but not stop entire blood flow to the area. The E stands for elevation, which helps us to promote lymphatic drainage and prevents some of the edema of fluid leaking out through the increase in vascular permeability. This is similar to compression, in which it's unclear on whether this truly helps with tissue healing. However, it does not seem to detract from it. So elevation is something that we could consider using. And that is our high rice, which is one of our common treatments for when we have injuries. So when we look at rice or high rice, these are things that are all taught in a first aid class and are covered in most textbooks. But I want to question whether this is really something that we should be treating injuries with. So there is an article that I'm going to have you guys read that just talks about an alternative suggestion to rice or high rice as part of addressing injuries. And perhaps the injuries might be able to heal a little bit faster than if we were to use this high rice formula. Now, going back to our therapies, these are the ones that are often used just in the field, or people are self-medicating or self-prescribing to themselves. And it's a question of whether we should be treating them or not. They might be good ideas for if the issue now becomes the inflammation itself. If we are dealing with too much swelling, or if we're having too much pain in the area, we could start to introduce these things in to the system. And although these therapies can work against inflammation, sometimes they're not strong enough, and we have to actually increase measures when inflammation has begun to run rampant within the system. One of those therapies that could be instigated by physicians would be a cortisone injection. Now, how a cortisone injection works is it inhibits phospholipase, which is part of the arachidonic acid cycle that ends up inhibiting prostaglandins in the process. So that's how cortisone injections can work, as well as it starts to congregate white blood cells and retain them in the lymphatic system, which then decreases the activation of calling them to the injured area. So by not calling more white blood cells into the area and having them diapedese out into the interstitium will also decrease the swelling in the area as well. It also acts on the blood vessel permeability itself to decrease it, in which then we have less fluid exiting out of the blood vessel into the interstitium as well. Another therapy that we have to treat injuries is platelet-rich plasma injections, or PRP injections. And these injections are a variety of different growth factors that will go in and help in the healing process. So when we start to heal the area a little bit more expeditedly, then we can decrease the inflammation in response to that injured area. Prednisone is one of the steroids that can be used when dealing with inflammation to try and decrease the extent of it. And it works very similarly to what we saw with the cortisone injection. So it will inhibit that phospholipase and ultimately inhibiting the release of prostaglandins. It also inhibits that white blood cell release from the lymphatic system. So there will be a decrease in diapedesis ultimately. And it also inhibits blood vessel permeability. Sometimes we can also use laser therapy in order to deal with inflammation. And the way that laser therapy works is when it's introduced, it actually does inhibit the activation of the cyclooxygenase 2 receptors, or it's a COX-2 blocker. So that can help to deal with the pain and the vasoconstriction. It also, though, activates endothelial cells to release more nitric oxide. So we have the vasoconstriction that's occurring because of the blockage of the COX-2 receptors. However, we can increase vasodilation again through the use of nitric oxide, and so we can get some of the issues with pain resolved, but yet still allow for the added healing because we get an additional increase in nitric oxide release. So this ends the video for lesson 5, which addressed some of the therapies that exist to deal with inflammation and injury. I do want you to make sure that you've gone over the summary questions to be able to answer those. And then I also have an article for you to read, which proposes an alternate suggestion to the rice or high rice formula, and instead encourages our patients to move.